Well, hello everybody and welcome to this month's video message. I'm here to meet some colleagues who we don't often talk or meet very often. But recently I was on a walk around and I went into one of the offices in Chertsey House where I came upon the Procurement and Materials Management team. And they started to tell me about the work that they do. And it did strike me that the work they do is so very important to how the rest of us go about doing our daily work, delivering care to patients. And also that there's actually some things we could do better together if we knew more about it. How do you go about making sure that the things we're using in the organisation are both the best quality item but also good value for the taxpayer?
Yes, we have national benchmarking that we use, but we also work closely with our clinical colleagues that it is fit for purpose. We have our clinical procurement group that we sit down, chaired by a consultant, but a lot of nursing staff, and it's an open forum. I'd say if anybody wants to add anything to gender, more than willing to look at anything that is brought up. So have you got any examples of where you've been doing this work with clinical teams, you found a better solution but actually was better value? Yes, we've looked at digital thermometers replacing tympanic thermometers. We were spending £40,000 on just the ear probe tips. The digital thermometer costs £20. Wow! And of course that means that saving then is released to spend in other areas of the organisation to support other types of care delivery. Yes, and I think the good thing, it was better for the staff to use, it's a quicker process and it's less intrusive for the patient. So it was cheaper, it saved time, but actually it was less intrusive, more comfortable for the patient, easier for the team to use. Yes. And that's exactly the kind of range of characteristics you're looking for, isn't it? How much do we spend every year on buying? I think going through on purchase orders, we've got around £40 million worth. Wow, that's a shopping bill. Yes. £40 million worth of shopping that we do to support the delivery of care in the organisation. As some of that's going by now. How do you know whether a ward needs 10 syringes, 20 syringes, 100 syringes? How does that happen?
What we do is we just go around the wards and departments, check all of their stock, the consumables.
What do you mean by consumables? What sorts of things?
Gloves, syringes, needles, pulp.
Do you know if a ward suddenly starts to use more or less?
Sometimes there's changes in the wards and that information is provided by the sister or the matron, fed back to us, and then we're changing it.
So there's an iterating discussion about the nature of the patients on the ward, what their conditions might be and what sort of equipment and supplies might be used, consumables, to provide care to them. Yeah. And you go every day to all of the departments, you and your team, or on a pattern?
Every day. Yeah. So every day we're ordering for the wards and departments, and every day we're putting away for the wards and departments.
So how much do we spend on consumables in the hospital every week, month, year?
About 300, 400,000 at least a month. Theatres is the biggest spender.
Course. Brian, it's really good to meet you.
And you?
Thank you for your time this morning. Have a great day.
Pleasure. Thanks.
So there you have it. Really interesting to meet colleagues who, frankly, I think many of us aren't even aware are members of the team. But the important work they're doing is to make sure that all of you and all of us have the things we need, the consumables, to deliver care to patients. But really importantly, to make the point that they are seeking to supply us with the best bits of equipment and consumable supplies at a good price, but they're focused entirely on the quality of what they're delivering us. And actually, by working together with them and testing new products, bringing ideas to the fore, involving them early in our thinking, we can actually do that work better together. So please bring your ideas to Melvin and his team, get involved, because that is how you will get the things you need to deliver care to patients.